I guess we see acne in all groups of people, and the frightening statistic is 85% of Australians have acne in their lifetime. Nowadays we know that stress can play a huge role, and we certainly see that in people, for instance, when they have stress during exam times, physical stress that can cause a problem. And we know that when people are stressed, that raises their stress hormones, and in turn that can turn on their acne oil glands. Now we're finding out that maybe there are some dietary factors, but maybe not in everybody. So certain people will have dietary triggers. There are some people who get acne and they have the perfect diet, and there are other people who maybe have an imbalance for what we think of is an insulin growth factor. So that's a very fancy way of saying if you have processed food. So that's why a natural healthy diet is always better. But there's a very strong case that you inherit what your parents had, but sometimes you just get acne because you get acne. Being a dermatologist for 25 years, there are a lot of tips in the trade. One of the things is good skincare to cleanse morning and night, which really is wash your face morning and night. The reason you do that is you get rid of dead skin cells, makeup, sunscreen that can clog the pores. Start off with an acne range, cleanser, an acne cream that can help, often over the counter. So it might be something that contains a glycolic acid, it might contain benzoyl peroxide, and then you get into the prescription products. So you may need to go to your GP, and the GP will pick a treatment for you. So it's very much an individualised treatment. Have you had problems with your outbreaks before?
Yes, mainly on my cheeks.
Yeah,
and
a little
chin.
bit of pitting there. Well, we all want to get better yesterday. That's the big deal. And we all want instant. So sometimes you have to say to people, this may take several weeks. Hopefully you'll start seeing a difference in the first 6 weeks. But certainly if I put a patient on treatment, I want to see that they'll be 50% better in 12 weeks. That's my goal. People think, I've had this condition, nobody can do anything more. And that's really sad for me, because a patient comes in and says, I don't know why I'm here, I don't think you can do anything for me or offer me anything. And that's not true, because we've got a whole army of things we can use. Reach out for help, because there's a lot of great help. There is always a good, safe, effective treatment. So don't think that you're going to suffer alone, because it can be turned around completely.
Well, Heinzie, there is no getting around it. Having a face full of acne just makes you feel dreadful, and even the smallest pimple can feel like a mountain on your face.
And look, while Dr See interestingly said that our genes can play a part, some people just get pimples, whether you eat well or not. Isn't that right, Rach?
What did you do when did you ever get pimples? Or?
Oh, I used to put this really harsh cream on and it used to sting, and I remember thinking, I cannot wait for my pimples to go. What about you?
Mum and I would put toothpaste on my skin.
That's right.
I don't know where that comes from.
The whole face?
Exactly,
Oh, my
yes.
God.
Don't know where it comes from, but these days, thankfully, there are incredible tools to help you management. So, Heinzie, have you heard of the Effaclar spot scan?
Tell me more.
The French pharmacy brand La Roche-Posay brought together a group of dermatologists to analyse thousands of images of people with different skin types and levels of acne. So from that data, you can diagnose your own acne with spot scan, which is accessible right via the website on your smartphone.
And am I right that this technology allows you to pretty much take a selfie and it will scan for pimples, blackheads and any spots that you've got, and it will read that and then give you a personalised skincare routine?
Exactly. So how amazing is technology these days?
Oh, I tell you what, I wish this was around when I was a pimple-faced kid, that's
exactly.
for sure.
And accessible, as I said, right on your mobile phone via the Spot Scan website. How good is that, Das? I mean, your kids are around that age.
Well, I've got one turning 16 in a couple of weeks' time, so right in that zone, Ray. As you said, it's a tough age, isn't it, when your skin breaks out, and some more technology that could help.